As you all know, urology is a very wide specialty which encompasses so many different problems across all the age groups, including pediatric patients, adolescent patients, adult men and females as well. So we deal with problems across all the age groups and across both the genders. Female urology is a specialized subspecialty of urology which deals problems specific to the females. There are many problems which are specific to the females and they require different special care and treatment and diagnostic modalities. So today I will be discussing some of the common problems which we often encounter in the OPD in the females who are coming to our clinics. One of the commonly problem encountered is that of the overactive bladder syndrome. In this, the patients typically complain of frequency, urgency and nocturia. In this, typically females have to go to washroom very frequently, every 5 or 10 minutes, and they have to have a severe urgency to go to the washroom, otherwise they fear they would leak urine. In severe cases, while going to the washroom, some people in fact leak urine in their undergarments. So this is a very debilitating condition in the females and they often come to seek treatment. We have multiple modalities of diagnosis, including urine routine, urine culture examinations, ultrasound and the urine flow tests. So in these cases, mostly we exclude other common causes of overactive symptoms like infections, any growth in the bladder or other things which can mimic similar symptoms. Once the diagnosis is established, we often give them treatment in the form of physical therapies which includes pelvic floor exercises, some biofeedback mechanisms, and in certain cases we might add some medications to decrease the symptoms. Only in those cases which don't respond to this more conservative approaches and medications, they might need to undergo some endoscopic process in the form of Botox injections. So these patients can be managed effectively, ranging from simple conservative approaches to complex care like that of Botox injection. Next most common problem which we encounter is that of pelvic organ prolapse. In this, what happens is a portion of the bladder or the rectum or the uterus comes out through the vagina, and the patients typically complain of something mass or growth protruding out through the vagina while they're laughing, sneezing or doing some heavy physical exercise. So after evaluation, generally the treatment is mostly conservative for small degrees of prolapse, while for larger degrees of prolapse, surgical treatment is the treatment of choice. For these type of patients who need surgery, robotic surgery offers a safe and feasible treatment option for these patients in which they come and get operated and can be discharged the very next day. So it's a minimally invasive procedure in which there's least pain and almost no to minimal blood loss and very less chance of infection and early recovery after surgery. Other common problem which we encounter in the females is that of urinary incontinence. Many people ignore the problem of urinary leakage or involuntary leakage of urine because they accept it as a part of their life. Many females think that just because of aging, it's a part and parcel of life that they have urinary leakage, which is very wrong. Most of these cases can be effectively managed with simple physical exercises and biofeedback and medications. So much so that these patients can remain dry most of the time and they will require the use of diapers to the minimum. Other common problems which we encounter is that of recurrent infections. Recurrent infections are very common in the females just because of the fact that their urinary passage is very short as compared to the males which have a longer urethra. And this urinary passage is located very close to their anal area, which invites the bacteria to gain entry into the urinary system very fast. So we often find females in the reproductive age group and the postmenopausal females having complaints of repeated urine infections. So treatment of these patients is again mostly conservative with the help of some exercises, some hygienic measures which we teach them, and with the help of some antibiotics on a long-term prophylactic basis for 3 to 6 months in these patients. It has been seen that with the conservative management and antibiotic therapy as such, most of the repeated infections can be decreased. There are other less common problems which we encounter in our practice, which also we deal and we diagnose and we treat them effectively. So overall, we offer the patients a very comprehensive care and treatment which ranges from simple measures to complex care.
subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.